In today's video, we are talking once more to Dr. Ania Weismann, an aesthetic radiologist with a successful aesthetic practice in California. Dr. Ania was on my channel not too long ago, and you enjoyed her just as much as I do. In today's video, we will be answering some questions you left for Dr. Ania under our last video, and we will also be talking about problem areas such as jowls and the under eye area and how to successfully treat these areas. So without further ado, let's talk to Dr. Ania. It is so great to have you back, Dr. Ania.
Thank you so much. It's so good to be here. I really enjoyed our last talk.
I did too, and my audience loved you, as I knew they would.
Thank you.
And they actually had quite a few questions for you. So let's start with those, and then we'll talk about, as I call them, our problem areas.
Sounds good.
One of the questions was, how do you feel about, I'm sure you're familiar with the skincare, The Ordinary, the line. Mm-hmm. How do you feel about that skincare line or skincare lines like that?
And I'm aware that, because I've also gotten a few questions, basically asking for less expensive products because some skincare products are really expensive. So I'll kind of go roundabout and then I'll get to The Ordinary. So I think it's really important to first say there really are no dupes. You can't get a $20 product that's going to be as good as a $200 product, because if that was the case, that would mean that the expensive products are nothing but a ripoff. You're just throwing away your money. So, your Toyota is not your Lamborghini. It's just not the same, but they both can drive you from A to B, maybe not in the same way. Maybe the safety profile is different. But so there's comparisons that are, or there's elements that are comparable for wheels, a steering wheel, an engine, and then there are elements that are not comparable. So that's sort of how I look at it. And I do think you can find good products that are less expensive. At the same time, I think if you're looking for certain ingredients, if you're not going to spend the money, then don't buy them at all. It's a waste of your money. So peptides are that example, because peptides are large, and actually certain hyaluronic acid, the heavyweight hyaluronic acid molecules are large. And so if you want them to penetrate into the skin, you need some sort of technology, which is going to cost money, to drive those ingredients deeper into the skin, because you have to bypass the natural barrier, which isn't going to let them in. So that costs money. So with peptides, I always say, if you're buying an expensive peptides, they're just sitting on your skin doing nothing. So don't waste your money on peptides. With other products like various acids, vitamin C, ceramides, you don't need to spend those dollars when you can get something that's, also good, but less expensive. So, the brands I've been thinking of, and I just haven't done the research fully yet, but a vitamin C that I really like, it is a dupe for the CE ferulic, is the Timeless vitamin C, which is a CE ferulic as well. And I've used that, I've tried it, and I think it's nice. And what I appreciate about Timeless even more than SkinCeuticals is they actually now made it in a pump, so you don't have air exposure, which is nice. I wish the bottle was darker because it still lets light in there, which degrades vitamin C, but it's certainly an upgrade from a dropper. And that's, I think, $25. The other, CeraVe has a nice, that PM moisturizer. It has ceramides, a lot of good basic ingredients, and that's a drugstore product. Another line that I think is good that isn't as expensive is Paula's Choice. They have some good lines. And so now, getting to your actual question with The Ordinary, I think they're in the same category. So they make products where, certain products focus on a particular ingredient. And I think that ingredient is good. The formulations are not going to be as complex. They're not going to be as sophisticated, but a lot of good ingredients are still there. And so you can get, if you're really targeting what you're looking for, let's say you want azelaic acid or you want vitamin C, with The Ordinary, you can sort of target that one particular product, and I think you can do quite well. So that's my roundabout answer to your question.
Okay, but you wouldn't, for example, get the buffet from The Ordinary, which is a peptide serum. You don't think that would
I
actually
would
penetrate?
not.
Okay.
I wouldn't get any peptide serum unless they can tell you this is what we've done to drive it deep into your skin. But they tend to avoid the question, and they tend to not do clinical studies to show you the effects of their products. So they just ride the bandwagon. Peptides are in. Let's make a peptide serum, and people will buy it because they're all buying peptides. But they will just, it's a topical that will just sit on your skin and do nothing. So if you like it and it feels good, well, maybe there's glycerin in there and it's hydrating you, and maybe there's bisabolol in there and it's calming the skin. But those peptides are not doing anything. It's just expensive. You can't have a $20 product with a driver. I mean, maybe I'm wrong. I'm not going to say you can't, but if you can, I'd love to hear about it. That's going to drive it in.
Okay.
It needs a vehicle.
Okay, good to know. Now, this wasn't actually a viewer question, but it's something I'm curious about. You mentioned hyaluronic acid, and there's a bit of debate about hyaluronic acid. First of all, it's in everything. But secondly, we know
that's also because it's a fad. They know people like it. Let's put it in.
That's true. But we also know that low molecular weight hyaluronic acid can be inflammatory. It's something our body secretes when we have inflammation. So do you think it's a good idea to even use hyaluronic acid unless it is high molecular weight, which then won't be absorbed?
With hyaluronic acid, what you said is absolutely correct. We know that heavy weight molecular hyaluronic acid is very different, and the short chain hyaluronic acid molecules can be inflammatory. But actually, even within that, there are certain short chain hyaluronic acid molecules that are actually beneficial. So it's almost size dependent, even in the category of small. And no one is going to tell you that, in the formulation or in the product, or, unless you go on these, you'd have to go on these educational seminars where they really discuss how they make the products, and they don't do that. It doesn't exist. So it really depends, and it's difficult to know. So for example, the brand Hydrinity, they have developed a driver for the heavyweight hyaluronic acid molecules, and also their products contain short chain hyaluronic acid molecules that are in the beneficial range. So they intentionally created the two because they vary in size and in what they're going to achieve. And what I have found interesting is for people who get filler, when you get filler injected into your face, it's a high weight molecular hyaluronic acid. And as it breaks down over time, it becomes lower molecular weight. And I wonder if the inflammatory changes that can happen to people years after they've had filler are related to this. And I think they're doing research on it now. I'm not fully up to date on this, so don't quote me, but it's something that made me wonder if maybe it's worthwhile, when your filler is old and not maybe a little misplaced, you don't like it as much as you used to, that it would be better to dissolve it before you re-inject, to actually get rid of the low weight. So it's an interesting topic. But back to skincare, it's difficult to know what you're getting.
It's interesting that you just brought that up with the filler, because I just got an email actually from a woman who has really struggled with her health after getting fillers. And it's something we don't hear too often about. So I want to make a whole separate video on that with you. But, we aren't told that this can happen. So
the long-term inflammatory change.
Exactly. So let's make another video on that.
Okay, sounds good.
But another question I got was, you mentioned in our last video that vitamin C is great, but that you aren't the biggest fan of ascorbic acid because it is very unstable. And that there are many other great antioxidants that can take the place of vitamin C. And so many of my viewers asked, what are they? So which are some of your favorite antioxidants that could take the place of vitamin C?
I'll start with saying it's not exactly taking the place of vitamin C. It depends on which angle we look at vitamin C from, right? Because vitamin C, without it, we get scurvy in our bodies, right? It's essential for collagen production. So that's the function of vitamin C. It's not an antioxidant property. It's the integral necessity of that vitamin in the production of collagen throughout our bodies, our bones, our skin, our joints, everything. That's why people who suffered with scurvy, their teeth were falling out and they had so many systemic issues. So in that sense, vitamin C is important and not really replaceable. However, with our modern diets, you often have enough vitamin C that you consume that you don't need extra topical vitamin C. If you add a little topical, you boost your skin, but it's not necessary. And for those purposes, I like the esters, like I like THD. I like various forms of more stable vitamin C because I feel that the consumer is getting what they paid for. It's stable, it will last. And then we're not too concerned. Was it 15%? Was it 10%? How much of it converts? You just know you're getting extra. It's almost like a supplement for your skin, but it's a topical one. Now, in terms of the antioxidant category, all antioxidants are little molecules that have an extra electron that they're willing to give away. They can gift it. And they just float around. And when a free radical who really is hungry for that electron, and the way the free radical damages our skin is by stealing it from molecules that want to hold on to it. But the free radical is stronger, deprives our body of that electron, and then our body starts to degrade, collagen degrading enzymes. And so those antioxidants step in and say, hey, take it from me. I have an extra one to give you, and leave the skin alone. So that's how they work. So in that sense, as long as they do that, it really doesn't matter what you use. But in terms of my favorites, I'm a huge fan of PQQ, which is that's kind of a newer, it's a powerful antioxidant. It's also a DNA repair enzyme. And so it's a very potent free radical scavenger. That's in the Alto Advanced Serum that I use that I like so much. And that's one of the reasons I like it. Another great antioxidant, which is actually in so many products, is ubiquinone or coenzyme Q. And that, again, you can take as a supplement, and it's in a lot of skincare, and it's small, but it's a really good antioxidant. Another one that's starting to show up in products, it's in some Skin Better Science products, it's in some Hydrinity products, and it's starting to, I would say, pick up momentum, is the Kakadu plum extract. If you've ever heard of Kakadu plum, that's actually vitamin C. It's the world's most concentrated form of vitamin C is in that plum. So they extract it, but then again, how they formulate it matters. And I've not researched Kakadu plum itself, so I don't exactly know, but I know that that's a really potent, excellent antioxidant derivative. So those would be just a few. But I think if you buy a generalized antioxidant serum and it has several antioxidants, they're going to be doing the job. In Skin Better Science, and actually in the new Elastin vitamin C, they really did do a dupe. That's really a dupe for the Skin Better Science one. They categorize them. So with your antioxidants, you can have water-soluble antioxidants, you can have fat-soluble antioxidants, and you can have enzymatic antioxidants. And so they can work in different layers of the skin, depending on which ones are, hydrophilic, lipophilic, what they're attracted to. And it just increases protection. A lot of sunscreens now have antioxidants. That's why when they say it protects against pollution, that's code word for our sunscreen also has antioxidants. So they're in so many products in our skincare, just kind of sprinkled throughout, I would say. And the other thing that I find interesting is a lot of these formulations now that are antioxidant formulations or protective or recovery formulations, they will include things like Micrococcus lysate or yeast extract. And so we're getting into microbes and bacteria and yeast that are secreting beneficial ingredients to the skin, which got me on this new journey of really taking into consideration the microbiome of the skin. Just like the microbiome of the gut is now very mainstream, everybody's aware of it. That same concept applied to the skin, I feel, is being birthed, and it's fascinating because if you have a healthy balance of all the bacteria that we live synergistically with on the skin, they also function to protect us. And they protect us from other pathogens causing infections, and they protect us in multiple ways. So it's interesting that these antioxidant serums are actually giving us extracts of microbes that benefit our skin. So that's my new line of curiosity and research right now.
That's great. That's again a whole nother video right there.
That's a whole nother video. Yeah, I'd love to do that.
Yeah, I would love that too. Now, another question I got was exosomes. How do you feel about them? And I know you made an excellent video on that already, and I will link that video.
I do have a video on exosomes. I would refer to that video. But I think exosomes are an extremely important topic right now because they are the new marketing term. And so you're going to be seeing more and more exosomes in everything. They'll be putting it in skincare, in washes, in sunscreens, because if people don't know what it is, they'll be like, oh, this is great, it has exosomes. So it's really, really important to understand what they are. And essentially they are, if you imagine a car with a turbocharge, they are the turbocharge for that car. So wherever that car is going, whatever it's doing, those little exosomes help it do it better, help get the job done. So if it's a cancer cell, the exosomes are going to do everything to help that cancer cell lock in, make more, reproduce. That's the powerhouse. That's the concentrate, the essence, if you will, of that cell. If you have a platelet or a white cell, part of the immune system, and they secrete an exosome, that exosome is going to be the essence of healing. So everything to get your blood to stop get you to stop bleeding, get you to make new vessels, get you to make new collagen to heal the wound. And all the cells in our bodies basically make exosomes. So it depends on where you take those exosomes from. And that's just the basic concept of exosomes. And then it gets more complicated because it has to come from somebody else's body. It has to be a donation of blood, if it's a platelet-derived exosomes, or stem cells. Again, they have to come from a donor. And then the question is, how do they grow them? How do they harvest them? How many times do the cells divide in the media for the stem cells? Because the longer they do it, the cells lose their potency. So the manufacturing process is crucial. And again, as a consumer, you never get to know this. It's really, so with exosomes, it's really important to know where they come from, what types of cells they come from, and even how does the lab produce them. They are very unstable molecules. They're very, very, very tiny because they're spit out by a cell. So they're obviously smaller than a cell. And they're packed full of tools that cell uses and assists, it assists in the activity of that cell. I hope I'm making sense.
You're totally making sense. Yeah.
Okay. It can get quite confusing. So they can be beneficial. They can be detrimental. And also they may be manufactured in a way where they're not effective. Like they're very, sensitive. So even from not the skincare perspective, but the professional perspective, the marketers, the companies that produce exosomes for sales to doctors and clinics, some are freeze-dried, they're lyophilized. Some are in liquid form, frozen at a very cold temperature. And even there they compete And the companies that make the liquid form, they say the ones that are freeze dried are not as effective when they're thawed and reconstituted. So ours are better because they're already in liquid form. You don't need to add anything to them. So even at that level, there's disagreement about the efficacy and effectiveness of the lysosomes. And now you bring that down to products that are at room temperature. You bring that down into products that are mixed in with something. I can't speak for any brand because I don't know their formulation, but just from what I do know, I can't imagine how you could stabilize an exosome to have a shelf life.
Yeah.
So it's a fascinating topic. They are incredible, but I think they're starting to get abused for profit.
I told you before we got started, I could kick myself because I fell for it. And I bought a $300 tiny little 15 ml of exosome
And again,
serum.
you know, when a product like that works, you have to wonder, well, what other beneficial ingredients are in here that are making my skin nicer? You know,
Well, I don't know if it works. It's so expensive. I don't even want to use it. I've used it twice.
I can totally understand that. Yeah.
That's great to know because, like you said, it is sort of becoming a buzzword, and we think
It's a buzzword.
we're missing out
You
if
really have to be careful.
Well, great. Thank you so much for answering all those questions. I'm sure there will be more under this video. But I also wanted to talk to you. I get quite a few women writing me, what can I do about jowls? What can I do about my under area? Those seem to be the two main, and I hate to use the word problem areas because, you know, it's
they're
not
the
really,
aging areas.
Yeah,
They're
it's something I think that affects all of us.
Yeah, they're the primary aging areas.
Let's start with jowls.
Okay.
What do you think some of your favorite treatments for jowls, or is there even something that can be done aside from a facelift that can help with jowls?
Jowls are challenging because we're fighting aging, but we're fighting gravity, and gravity never stops. And in terms of treatments, I feel that it really depends on every single individual. It depends on the way it's not even your skin, but the way the layers of your face are made. Some people, they have a heaviness to them, but they have thick skin without any wrinkles. Other people, they start to get the jowling and you can see the lines and creases on the skin. The skin is just so thin. So different approaches. It's not a one fix for all. It's not even a one recommendation of treatment for all. But if there's a heaviness, I like PDO thread lifts. So you make not an incision, but a puncture here, and you insert threads and you pull up the jowls. Now, if anyone is interested in that approach, the only thing I would say, just to let you know in advance, is those threads come in two different ways that they're produced. There are threads that are called cut threads. And what that means is if you imagine a tube and you imagine you make a cut in it, so now there's like a piece sticking up, that is what hooks onto the tissue. But if you think about it, if you have a tube and you cut into it, you've now compromised the integrity and the diameter of it, so it's not as strong, and those ones can rip and they're not as good and they don't last. Then there are other threads called molded. So keywords for research: cut threads, molded threads. And the molded ones, if you have that tube, what they do is they attach little barbs that will hook into the skin. So they are very, very strong. And those are the good ones. If you're going to get threads, get barbed threads. And that's a nice lifting procedure. And again, difficult to predict. Some people have beautiful results that last a year to a year and a half, and then they need a touch up and they're good to go for several more years. And other people will have results from a few months and then they're gone. And you can't predict. I will just say, if you've had them once and you had a particular results, chances are you'll have the same result again. So, but that's a quick mechanical. I always call it the segue to a facelift because there's no cutting, but there is something lifting you up.
Just out of curiosity, what happens to the extra skin? So you're pulling up the skin. What happens to that extra skin?
You're not actually pulling up the extra skin. You're pulling the tissue underneath the skin up.
Okay.
So someone who has so much skin, extra skin from the stretch, they're not a good candidate for threads at that point.
Okay.
It's too late. It's too
Okay.
late for them. Then it's more of a facelift situation. Other procedures, skin tightening procedures, the radio frequency procedures, those are hit or miss. They really work well for some people and they don't work at all for other people. So it's one of those, until you spend the money and you try it, you just don't know.
Mm-hmm.
One trick that I think is great and it works pretty well is, instead of actually addressing the jowls, you're causing a visual trick. You inject filler along the jawline to lower the jawline a little bit and match the jowl.
Okay.
And you can sharpen the angle of the jaw. And so you've effectively matched your chin, your jawline, to your jowl, and it makes your jowl disappear a little bit.
Okay.
Which is an interesting way to do it. It actually looks really nice when done well. And that's, I would say, a relatively easy trick. And the reason why it actually also makes sense is, when we get jowls, a couple of things are happening. So from the layers of our skin, the bone resorbs as we age. So that's why taking vitamin K, which protects bone, and vitamin D, they help that slow down. But so you're losing that volume, so things are going to start hanging. Then we go into the middle layers where those ligaments start to stretch, gravity's pulling them, and so there's just hanging from looseness. And then the top layer, which is the skin. So some people have very loose skin. They have thin skin and there's almost too much skin. Those people actually benefit from, have you heard of Elor? It's a new device.
I have heard of it.
I have, just a side note for 1 second, but people who have excess skin, they can benefit from that. My only concern with Elor, people get a lot of post-inflammatory erythema and a lot of post-inflammatory hyperpigmentation. It's a serious downtime. And I feel that if they just prep their skin and strengthen their skin before the procedure, they would recover so much better. And most people that perform this procedure don't talk enough about skin resilience and how to create it. So I'm not a fan of Elor in general, and I feel like it's used in people that don't get the people who wouldn't get much benefit from it are people like you. You have good skin already. It's not loose. You don't have excess. You don't have lines. And so taking out a little bit of skin isn't really going to change much. And also, my other issue with Elor is that if you make a hole because you take out a piece of skin, if you were to close it again with, let's say, a compression device, then it makes sense. It's like if you cut yourself and you stitch it up, you get a tiny little scar. But if you cut yourself and you just leave it open, that's just going to fill in with scar tissue. You're not really closing anything back up. So even though I'm not a fan, I have seen good results in people with that excess skin.
Okay.
I do think skincare makes a difference. I think Sculptra makes a difference. If you can really, reboot your skin to start acting younger with collagen production, you can help it. You're not so much treating the jowls, but when you're treating all of this as well, and this is getting tighter, this will pull back. So you're coming at it as a unit. And I think that helps just the overall appearance, but it does minimize jowls because everything gets tighter. So I'm a fan of that too.
Okay. Now, I always get a bit confused when we talk about jowls. There are jowls when people have sort of skin hanging here, right? And then there is what I call perioral folds. Is it the same thing? Is a perioral fold and a jowl the same thing?
No, you're correct. They are different. But I find that a lot of the time when people come and sit in my chair and they complain about their jowls, they're pointing here. So when I talk about it, I sort of include this whole area because the mechanism is sort of the same. This is falling The bone is resorbing. And so everything that will fix this will help this as well, with the exception of the filler along the jawline that will really just address the jowls and minimize them. You just have to be careful that it's done well, because if you overfill this area, you can make them look heavier. So if it's done well, it looks really nice.
Now, as far as threads, which seems to be one of your favorite procedures for that, are there any risks, any side effects, anything we would have to be aware of?
And the other treatment we can talk about is also radiofrequency microneedling. So we can finish with, add that next. But in terms of threads, it is an invasive procedure. So this area is injected with numbing. Topical numbing isn't enough. You do have a foreign body in there, so it has to be a very clean procedure. The risk, if not done well, if the person placing the threads is not in the correct plane, you could hit a nerve, so the patient would have pain that would be long lasting. You could hit a vessel. You could undulate in the plane, so cause an uneven appearance, cause dimpling. So yes, it's a skilled procedure. So those would be, infection would be another risk. So it does require some skill. The idea of how they work is that the thread gets placed. Your body recognizes that there's a foreign body. So it starts isolating that foreign body and covering it in a thread of collagen. It's actually, if you think about it, it's like a thread of scar. And so when the thread dissolves, you're left with your own natural thread that your body made, which is actually scar tissue, but it's going to continue holding where the thread was. And that's the concept of how it works.
So it's similar to Sculptra. I would imagine it's PLLA or something like that, polylactic acid.
It's it's suture material. Yeah.
Okay.
It's polyldaxone, PDO is what they're called. Yeah.
Now, if one in the future, if one gets threads, and in the future, because I've heard this as well, that you couldn't do a facelift if you wanted to in the future. Is that true because of the scar tissue, or is that?
It's not true. I know surgeons are kind of on the fence about it. I feel part of it is fear of losing business. That's one aspect of it. Again, the scarring is just literally a thread. So if you placed 4 threads here, you'd have 4 tiny little lines that you'd find. I've uniformly heard surgeons say that they can see that there were threads in the face, and that makes sense. But that it's a hindrance to their surgery, that I've heard very mixed. I've heard surgeons say, no, that's nonsense, not at all. And I've heard others say, yes, it's terrible. Don't do threads, just get your facelift. So they have their own opinion. I'm not a surgeon, but they have their own opinions on that. But they do leave a mark. You can see that someone had threads.
Not visibly, but if you do a
ultrasound. If you cut in to do surgery, you can see it. Yeah.
Okay. Yeah. Good to know. Now you were talking about radiofrequency microneedling. So to address
radiofrequency microneedling is another that's marketed for tightening the skin. So if you have that loose skin and that's where your jowl is coming from, it can really help. But with radiofrequency microneedling, I feel that it's really, really dependent on what machine is used, and they're not all made equal. And so it shouldn't be overly painful. And the machines that are extremely painful and that you can feel your muscles contracting when you're getting the treatment, those settings are so high that the problem with getting too many of these treatments is patients get superficial fat loss. So their skin tightens, but they lose their volume and they're not happy with their results. And it's always because some machines they're too strong for the face, and they cause, I think, more damage than good. So
I had radiofrequency microneedling. I had 3 sessions, and I do feel that caused quite a bit of fat loss in my face.
I've had 2. And I would never do it again. And if I were to do radiofrequency microneedling, the Silfirm X is the only machine I would use. It's a new machine out of Korea, And it has a brand new technology that none of the other devices has. It has continuous wave energy flow, and it has pulsed wave energy flow, which means the energy flows, stops, flows, stops. And it's the only radiofrequency microneedling that can actually be treating rosacea and melasma because of the patented technology. So this one is really, I would say, gentle enough to cause a lot of benefit with minimal side effects.
Okay.
Yeah, there's a physician named Dr. Na who was the creator of this machine, and I think that is a good one. And I'd be skeptical of all other ones, to be honest.
To minimize the risk of fat loss, could you just do it in that area? Or would that not be beneficial since you want to address the whole cheek area?
I think we have to remember that devices in general can only do so much. So if you were to do that and you did get tightening in that one area, it wouldn't be noticeable. But you have a better chance of getting a visible result if you treat the whole thing and you get, a micro lift at every level, and then you'll see a little bit here.
Okay, that makes sense. Okay. Now, what about the under eye area? That's also a concern I hear quite a bit. We lose, of course, fat pads under the eyes, and all kinds of things start to happen. What are some treatments you like to do for the under eye area to improve that?
So just as you said, it's the loss of the fat pads that we primarily see here. And in some cases, it's the weakening of the orbicularis oris and the bulging of excess fat from underneath. So people who get these little pillows, they can get beautiful results with a blepharoplasty. So that fat gets transposed and moved down, and the bulge is gone. But the fat loss that you're thinking of, just the hollowing that happens over time, I think filler is a great alternative. So you're basically replacing that volume deep on the bone. So you're imitating bone and returning the volume to what it used to be when you were younger. And the other thing I'm a fan of in this area is just vigilant skincare. It doesn't have to be an eye cream, but it has to be vigilant skincare. That part of the skin is just so delicate. It doesn't produce a lot of oil. There aren't big pores there. So we need to hydrate it really well. We need to stimulate collagen there really well. So I'm a huge fan of retinol around the eyes. I'm a huge fan of laser resurfacing. Anything to stimulate collagen there so the skin stays stronger, because it's really just that's it. You've got that little fat pad that you may need to refill, and then it's just the skin. So really working on that skin can make a huge difference as well.
Any treatments that are beneficial for under eye discoloration, which is also a concern many have?
With under eye discoloration, the most important thing is to differentiate what type of discoloration you have. It could be the skin, so it's genetics. If your mom and dad have it, you'll have it too. It could be vascular, or it could be a shadow that is caused by your anatomy, how deep your socket is, how much your eyebrow protrudes, and how hollow you are here. So once you establish the cause of the hyperpigmentation, or let's say the darkness, then you can treat it. So for vascular, you can use lasers. For pigment, you can use lightening creams. It really varies on the cause. I don't want to give advice because I think it's really important to first identify what is causing that darkness around your eyes.
I could, just like last time, I could talk to you for hours, and we have many more subjects to talk about. So I really hope you will come back.
Thank you. I definitely will.